Hi, Tracy Bakewell from Vitality, talking about estrogen and menopause today. So after that up and down fluctuation of hormones in perimenopause that can last for years, you eventually go into menopause. So the definition of menopause is 12 months without a period, and the average age of menopause for females in the United States is 51. For some of you, you may not think anything about that number, but to me that seems awfully young, especially when we think about all the amazing things that estrogen does. It has over 400 functions in the body, and a lot of times I feel like we think of estrogen and we think of reproduction and fertility and things on the surface, skin, full hair, nice curves, but it's so much deeper than that. Estrogen is really, really amazing for our bones, extremely protective of our heart and brain. 2 out of 3 females end up developing Alzheimer's dementia, and the leading cause of death in females is heart disease, not breast cancer, heart disease. That's all very alarming to me, knowing that it's inevitable and my risk will go up after menopause and I can't avoid it. And estrogen has gotten a really bad rap for years, decades actually. I think estrogen is just poorly misunderstood. It's actually truly amazing, all the amazing, wonderful things that it does for us, internally, externally, and it can be life-changing. It really matters the provider that you have, the dose, the delivery, the continued monitoring of symptoms, and the right tests to monitor those. So if you're watching this and you're wondering if estrogen replacement therapy could be right for you, come talk to me about it. We'll talk about it all when you're ready.